Hello, everyone. This is Dr. Sin, your board certified OBGYN, national speaker, and vulvar skin specialist. Thanks for joining Unveiling the Private Face. So, as you guys come in, please like and share. Please like and share as you guys come in. Thanks so much for joining the Private Face tonight. Unveiling the Private Face. And what we're talking about is 10 tips to prevent ingrown hairs. So I think this is a topic that most will enjoy. 10 tips. 10 tips to prevent ingrown hairs. So as we give time for others to join, I always have a trivia question. So the trivia question for tonight is, when was the first razor for women, specifically for women, created? Okay, that's our trivia question for tonight. Hello, Tracy. Thanks for joining us. As you come in, please like and share. So, does anyone know when the first razor, specifically for women, was created? So, as you come in, like and share, and we're going to get into our topic in just a little bit. We're going to give others time to come in and join us. So happy that you guys are here. I see Yolanda Law. Thanks for joining. Thanks for joining. And I have an OBGYN. We are coming live for both Facebook and Instagram tonight. So as you guys come in, please like and share. Last week, we did the private face smoothie. I've received a lot of personal messages in reference to it. Many people liked it. And so I want to get some feedback tonight as to anyone who tried, what your experience was. Hello, Miss Denise. Thanks for joining. As you join, please like and share. Has anyone tried the private face smoothie? Some of the questions I received were, if you're allergic to pineapples, is there a substitute? Is there anything else you can use? Of course there is. You can completely remove the pineapples, maybe increase the amount of mangoes that you're using, or if you want to add an additional fruit, like passion fruit, dragon fruit, things of that nature, that's something to try, okay? So, hello, Deborah, how are you? As you guys come in, please like and share. And our trivia question for tonight is, who created the first razor specifically for women? Does anyone know the answer to that? Not the first razor in general, but the first razor for women. Does anyone know the answer? So as you come in, please like and share. Also, has anyone tried the private face smoothie? Tell me what you think. Some of the other comments that I received is some women, as opposed to using the Activia, because they already had regular Greek yogurt in their refrigerator, they chose to use that, and that's quite all right. It is still full of probiotics, and so that's the important part when it comes to making the private face smoothie for vaginal health. Oh, Tracy Dawkins says, I loved it and saw a difference in 2 days. My new morning drink. Wonderful. The private face smoothie in general, it promotes overall health. So it's a good meal substitute, especially in the morning if you're in a rush. You could take everything, all the ingredients, pre-package it, throw it in a freezer, and just pull them out as needed. So that's just something to think about. Hello, Tamika. She has the correct answer. Gillette. Gillette in 1915 created the first razor for women. Now, years ago, razors were used for men, but this was the first time a razor was created for women. Now, that doesn't mean it took until 1915 before women were actually removing hair on their body. You can go back to ancient Egyptian times and see where this was done. All right, it was even done, the Romans did it. It was a sign of higher class for women who had no hair. If you go back and look at, Queen Elizabeth, different people of that nature, a lot of times they didn't have eyebrows. They removed their eyebrows because it was supposed to be a sign of higher class. Now, I'm not recommending that. I'm just giving you guys a little bit of history. Okay, as you guys come in, please like and share. Oh, I have another one. The smoothie was great. Wonderful. Did anyone notice a difference in smell or a difference in taste? I guess that's something you would have to ask your partner. Did anyone notice those type of differences? So as you guys come in, please like and share. All right, so once again, I am Dr. Sin, your board certified OBGYN national speaker and vulvar skin specialist. Through my teaching sessions, I help women to understand and optimize the skincare of the vulva, or what I like to call the private face, so that they can realize that this area can be just as beautiful as their public face. Okay, so tonight our topic is 10 tips to prevent ingrown hairs. Okay, 10 tips to prevent ingrown hairs. Hello, Kimberly. Thanks for joining. As you join, please like and share. All right, so first of all, what is an ingrown hair? And tonight we're talking about ingrown hairs of the private face, of the vulva, the mons pubis, things of that nature. So, how you develop ingrown hairs is that as your hair comes out of the skin, sometimes it starts to curl and it can curl back under the skin. It can become embedded in dead skin scales, and that's what forms an ingrown hair. As you all may know, ingrown hairs, they can become quite tender, a little reddened. It can appear as a raised bump, and that's how you know you have an ingrown hair. It's very, very common, so it's important for women to know how to treat this problem. Now, the most common reason why we get them is because women are shaving down there. So as you shave, you need to know the things you need to do to prevent it. So let's get started with the 10 tips to prevent ingrown hairs. The first tip, don't remove the hair. That is an option. All right. Now, some women may still develop ingrown hairs even if they don't remove their hairs. You're at increased risk for ingrown hairs if you have more coarse or curly hair, because as that hair curls, it can curl back under the skin as it continues to grow. But it is an option. If you notice with shaving or with other hair removal techniques that you're seeing more ingrown hairs than what you're used to, you always have the option to not shave. Okay? You could just trim the area. The other thing that you could do, if it's becoming a true nuisance, is try other hair removal options. Okay? Some ask, what about waxing? Is waxing better than shaving when it comes to ingrown hairs? And the answer is yes. Waxing is better than shaving. Now, is waxing technically better for the overall skin health than shaving? Not necessarily. You can still get ingrown hairs from waxing. All right. Now, with shaving, you have that sharp edge once you shave the hair off. You don't have that with waxing. But later, as the hair starts to regrow, you may have some issues with ingrown hairs. Other option is removal of hair with depilatory creams. A lot of women have noticed less ingrown hairs if they remove the hair with depilatory creams. So that's an option. Other option is laser hair removal. Now, it's more expensive, but you have to think about it. You pay that upfront cost, then you're not really worried about hair removal for years to come. Can the hair grow back? It's always a possibility, but usually there is less hair and it's less dense. So if shaving is just way too much for you, those are some of your other options, okay? So our number one tip is just don't remove the hair at all. Our number two tip is to use other options for hair removal. Okay, now, for those of you who are shaving, the most important thing to do is use proper shave technique. If you use proper shave technique, you will notice a marked decrease in the amount of hairs that you see. All right. So, what are the proper shaving techniques? First off, you want to wash before you shave. All right. So, you want to make sure that the water is nice and warm because you want that skin to get really soft. All right. And then you want to exfoliate before you shave, not after you shave. Exfoliate before you shave. The other part of proper shave technique is using a sharp, clean, single blade razor. So I know we talked about this before, but as far as the razor being sharp, the more often you use that razor, the more dull it will become. So 3 and out. You use it 3 times and then it's time for a new razor. Clean. You want to use a special razor for your special area. Do not use the same razor on your underarms and your legs. So if you want to color code your razors, that's fine. But make sure that the razor is clean. And then a single blade razor is ideal. So those are some of the things that you want to do with shaving. The next thing prior to doing the shave itself is that you have to use a shave gel or a shave cream. One for sensitive skin, I recommend the shave gels that actually have the aloe vera in it to promote healing. Okay, because if you shave on dry skin, it is definitely going to cause more friction. It's going to increase your risk for bacterial infections and therefore increase your risk for ingrown hairs. The other thing that you want to do within your proper shave technique is shave with the grain. All right, so you don't want to go against the grain, you want to go with the grain of the hair. Do not pull the skin super duper taut to shave, because the closer you are to the skin, the more trauma can occur. So these are some of the things that you want to do. And then immediately after shaving, you need to hydrate the area. It's important to keep moisture in the area after shaving. All right, I see here coochie shaving conditioning. Sounds great. It's the best. I have not tried that, but I will. I try to use everything that people recommend so I can give my 2 cents as far as if it works or not. So you guys keep that in mind. There's a recommendation for coochie shaving conditioning cream, and Katie says that it is the best. All right, so our number 3 option was proper shaving technique. So first, don't remove the hair at all. Number 2 were other options for hair removal other than shaving. Number 3 was proper shave technique if you just have to shave. Number 4, exfoliate. Exfoliate is the key, because the biggest issue with ingrown hairs is that you get this layer of dead skin cells and the hair follicle just can't get out. So it grows underneath the skin. So we have to get rid of that layer of dead skin cells. Now, of course, we're going to exfoliate prior to shaving, right before we're shaving, when we're in the shower, things of that nature. But you need to also exfoliate often. If you're removing the hair down there, you really need to be exfoliating. Now, granted, there are a lot of creams and exfoliators that we can use, but some of the simple things that we can do is before we get in the shower, how many of you guys have what's called a dry brush? A dry brush you use and you just brush your skin, and that dry brush removes dead skin cells. It's good to do before you actually get in the shower, so we've kind of gotten rid of that layer of dead skin cells, and it's supposed to promote your lymphatic system as far as getting rid of toxins in your body. So you can also use the dry brush in the private face. Some of the dry brushes are pretty big, so if you don't want to use a big dry brush, the other thing you can use is a soft tissue, a soft bristle toothbrush. Make sure your toothbrush is color coded. Keep it in a shower. Even with the toothbrush, you don't want to use it too often. All right, use it a few times and then go get another one. It could be a cheap toothbrush. You just want to make sure the bristles aren't too hard. And with that, not only can you brush the mons pubis, that being the area, if we're just standing up and we're naked, the area that you can see, but you can also brush between the legs with the labia at the labia majora. Just be gentle when you're doing that, but that is an option as well, because what you're doing, you're getting rid of those dead skin cells, and we're decreasing the chances of developing ingrown hairs. So those are some of the options when it comes to exfoliating. So the other thing that we can do, because some people, once again, even if they are not shaving, if they're not removing the hair because of their hair type, they may still develop ingrown hairs. So for women who are not removing the hair, what they can use is a comb. Do you guys remember in school when they used to give us those little tiny combs to comb your hair before picture day? And our mamas used to tell us, do not use that comb on your hair. You're going to mess your hair up. One of those little combs is perfect. It's small enough to get into the area. Or if you want to use a thin rat tooth comb, that's fine. Once again, please remember that this comb is only for the private face. So it's something that you would keep in the shower and just do it when you're in a shower. That way, any hairs that are starting to curl under, we have an opportunity to kind of pull them out as we're combing the hairs. And this is for women who choose not to remove the hair down there or not to remove it completely. So if you have a landing strip or if you're just trimming, things of that nature, this is an option for you to use a comb. Also, we need to keep that area hydrated. So moisture is key. Make sure you're using a decent moisturizer on the private face, especially if you're removing all your hairs. So I'm going to stop for a second and see if there are any questions. Does anyone have any questions right now? I appreciate all of you guys joining. And once again, as you join, please like and share. Please like and share as you join. So thus far, when we've been discussing 10 tips to prevent ingrown hairs, we've discussed not removing the hair, other options, that being waxing, depilatory creams, or laser hair remover. We talked about proper shaving techniques, exfoliating, combing the hair if you have hair there with the little tiny combs, okay? A big comb, a wide tooth comb is not going to help you. You need the really thin combs. And hydration was number 6. Does anyone have any questions right now? And we'll continue. All right, Miss Benita, if you have ingrown hair, should you see a doc to have them removed? Not necessarily. So let's talk about treatment options super quick. So if you notice an ingrown hair, the very first thing I don't want you doing is digging. Do not go digging in there trying to get out the ingrown hair. If you happen to see the raised part of the hair and you can see the hair going back in that scenario, you can gently go underneath it and try to pull the hair out. But other than that, do not go digging. The key to treating ingrown hairs is warm compresses. So what I recommend is wetting a washcloth, literally putting it in a microwave for about 15 to 20 seconds. You want to shake it out, blow it. I do not want you guys burning your skin, so make sure it's not too hot. But then placing that washcloth on that area and leaving it on there for about 10 minutes. If you do that 3 times a day if possible, in 3 to 4 days, it should come out. It should come to a head and come out. The other thing that's important to do during this time is exfoliate. You do not want to use a harsh or an aggressive exfoliator. You want to make sure it's a mild exfoliator. If you continue to have this problem, or if you notice that it's becoming larger and that the rim of redness is expanding out, then I want you to be seen. If those things are happening, you need to go in to be seen by a doctor. If you've done all the treatment options and you still don't have relief and it's becoming super painful, you need to go in to be seen. Let's see. Katie says, how do you treat ingrown hairs once it happens? All right, so we just discussed that. Any questions about the treatment? If you have an ingrown hair that you are treating, do not continue to remove hairs. You have to stop removing the hairs in that area. So no more shaving, waxing, none of that until that ingrown hair is resolved. You can place soothing ointments on there, like tea tree oil is good. Believe it or not, a little manuka honey is good. Just make sure after placement you wipe it very well. So those are options. So once again, thus far we talked about 6 tips. 1, not removing the hair. 2, removing the hair with other options other than shaving. That being waxing, depilatory creams, electrolysis, or laser hair removal. Number 3, proper shave technique. Number 4, exfoliate, exfoliate, exfoliate. Number 5, use a comb, a thin tooth comb if you have hair down there. Number 6, hydration. So all of you women who are bare, you need to be putting some type of moisturizer on your private face every day. Make that a part of your daily morning routine. So our 7th tip, clothes that are too tight, it'll get you every time. We talked last week about clothes too tight affecting your vaginal health. It can also cause ingrown hairs. So you want to make sure that it can breathe down there. So be careful with the tight clothes. Number 8, don't tweeze. It's so easy to see that little hair that you didn't quite get with shaving, and you just want to grab the tweezers and just pluck it out. Well, when you pluck that hair out, it's possible that you left a little bit of the hair shaft in there. And if you did that, that shaft can start growing in on itself and you'll get an ingrown hair. So try very hard not to tweeze. All right. No camel toe, someone said. All right, we'll talk about that on another discussion. So don't tweeze. Number 9, wash before you shave and wash before you wax. It's so common that women go to wax right after work, things of that nature. If you're able to shave before you go wax, that's ideal because you are making sure, not just the esthetician, but you're making sure that you've removed the bacteria from the area. And actually with washing, that skin is warm at that time and it's nice and supple, and it make the waxing process a lot easier. So if you're shaving or waxing, please try to wash right before. I'm not saying you guys don't wash, but it's common that we have other things to do during the day and we may not have time to take a shower before we have that procedure done. If you're able to shower before waxing, please do that. Hello, Tia. Thanks for joining. And number 10, vitamin A. Vitamin A is very, very good for the skin. Not only does vitamin A prevent acne, it also helps to prevent ingrown hairs. So you may hear of some people who've gone to the dermatologist and they're using retinoids. Then that's super aggressive. That's like the Hulk Hogan of vitamin A type treatments. We're not talking about that. We're talking about vitamin A in your diet. So one of the things that's full of vitamin A is spinach. So that's in your vaginal face smoothie, your private face smoothie. The spinach is very high in vitamin A. Sweet potatoes is good as far as vitamin A. Carrots. Liver, for those of you who like beef liver, liver is good. Whole milk, fortified skim milk, eggs. Those are very good in vitamin A. It's not necessary to take a supplement. The key is making sure that it's in your diet. So if you're doing the private face smoothie in the mornings, you're going to have your vitamin A. And that's our number 10 tip. So from the top, number 1, don't remove the hair. You will have less ingrown hairs if you don't remove the hair. Number 2, other hair removal options than shaving. Number 3, proper shave technique. The proper shave technique: wash with warm water prior to shaving, exfoliate before shaving, sharp, clean, single blade laser. We're going to use a shave gel or shave cream. We're going to shave with the grain of the hair, not against it, but with the grain of the hair. And we're going to hydrate immediately after shaving. So that's number 3, proper shave technique. Number 4, exfoliate. Exfoliate, exfoliate. Exfoliating is key. Number 5, comb the hair if you have hair down there. A thin tooth comb. Number 6, hydration. Make sure, especially if you're removing the hair, that you're hydrating that area on a daily basis. Number 7, tight clothes. It will get you every time. So be careful with the tight clothes. Number 8, do not tweeze. Do not tweeze. And number 10, make sure that you're using the vitamin A supplementation. So any other questions right now? Adrian says, number 1 is not an option for me. And for a lot of women, number 1 is not an option. And that's okay. So as long as you're using proper techniques and really are proactive with preventing problems, then you're good to go. If you notice with whatever technique you're using that you're having more ingrown hairs, you're having more irritation, things of that nature, then we have to change the game. We have to figure out something different to do. There's a lot of options out there. So there's a lot that we can do. Let's see. Armenia, can you use coconut oil? Yes, you can use coconut oil. You do not have to use a generous amount. And that's something that I would recommend using daily, just a small amount. Because once again, we don't want to clog our pores. But a small amount of coconut oil in the mornings after you get out the shower, after the area is completely dry with your towel, it's quite all right to use a little bit of coconut oil. I had asked earlier in this setting, had anyone tried the private face smoothie? I had some responses, so I want to take time out to ask that again. Has anyone tried the private face smoothie? And if you had, please tell me your results. If you can put that in the comment box. Has anyone else tried the private face smoothie? If you have any questions about tonight and you were unable or not really comfortable with putting it in the comment box while we're live, I will be looking at this later and I will try to answer everyone's questions in an appropriate time frame. So once again, I am Dr. Sin, your board certified OBGYN, national speaker, and vulvar skin specialist. Through my teaching programs, I help women to understand and optimize the skincare of the vulva, or what I like to call the private face, so that they realize that this area can be just as beautiful as the public face. I announced last week that I have started Virtual GYN, and that's a site where women can go to obtain telehealth medicine appointments for gynecology problems. So if you have urgent GYN needs, or if you are in need for a second opinion consult, please visit virtualgyn.com. That's virtualgyn.com and schedule an appointment. Thank you guys so much, and I hope you all have a wonderful evening. Good night.